Hi, my name is Nisa Far. I am a first-year dental student at the University of Colorado School of Dental Medicine. So I was quite lucky in that I actually graduated from my undergrad in December, so just a couple months before the pandemic hit. So I had a gap of about 9 months before school started in August, and my plan was I moved to San Diego at the time to live with my husband, and my plan was just to get a temporary job during that time and work a little bit before school started to save some money and also just maybe do something a little bit different. And so I ended up getting a job at a coffee shop part-time, and then I was also a dental assistant part-time as well. And so I was working for a couple of months, and then obviously the pandemic hit mid-March and things drastically changed over the course of a week. So in the coffee shop I was working at, things really slowed down, and they're a small business, and so they were quite panicked when things really started to hit. And so I temporarily ended up getting laid off just in the midst of it until they could get a small loan to pick back up. And then also the dental clinic had closed. And so during that time, my husband and I were kind of in a period of transition where we were moving to a new apartment. And then when the pandemic hit, we realized that maybe it doesn't quite make sense because we were planning to live on campus where he was attending school and close to where I was working. And then neither of those things were suddenly happening in person anymore. And so we ended up moving in with our in-laws because we figured that quarantining with them would be nice company. And it ended up working out quite well for us because it allowed us to save a little bit of money because we were kind of in a tricky financial situation at that point because I wasn't working. And but as a result, we ended up living with them for a few months before moving back to Colorado for school. And during that time, I ended up just kind of working on some of my own hobbies, kind of doing a little bit of a side gig to try and make a little bit of money at the time. But kind of reflecting back on it, it ended up being a bit of a nice break from the hecticness of school and working, especially before things picked back up in school again. So I definitely saw around me a lot of people, struggling quite a bit. They were losing their jobs as well and struggling to just kind of figure out what their next steps would be. So I definitely consider myself to be quite lucky in that I wasn't taking classes at the time, and we had a little bit of flexibility in terms of what we were doing during that time. I don't think it ever seriously crossed my mind, to be completely honest. I think part of what was reassuring is that I had a few friends who were in dental school at the time. And so kind of watching them go through the process of that transition to online classes and shifting out of like the clinic environment and the in-person environment. Of course, it's a transition for everybody, and it was pretty stressful at times. But I think watching the way CU kind of dealt with that transition, for me, was pretty reassuring that starting in the fall would be okay. And for a while, I didn't even think that it was going to last for this long. I thought that by May, I still thought that we would potentially be starting back in person. But then by June and July, it was clear that we were likely not going to do that. And so the school did the best that they could to be really communicative about what things were going to look like in the fall. And again, I felt pretty reassured about starting in the fall because a lot of the first year consists of a lot of didactic classes where you're mostly actually just in lecture. And so that format does work out when you're doing it over Zoom. Obviously, there's pros and cons to it. And it's definitely challenging at times not to be in person. But I think I personally felt okay starting in person because of watching the experience that my friends had going through that in the spring and summer. I would say for the most part, they were very supportive. I think there were a lot of questions, and there always still are. I talk to my in-laws a lot, and they're like, how are things going with classes? Or is everybody being safe? And so I think that when I share with them the safety protocols that the school is taking in order to prevent the spread of COVID, and also the fact that I'm really only on campus for class every other week. And so that definitely limits the contacts that we have on campus. So that's been reassuring. I think if I was maybe in clinic a little bit more often, that would be a different question. And I think the interaction we would have is a little bit less. But they were very supportive, I think, of us moving forward with starting this year. I've definitely been trying to be really conscious of the contacts that I have and trying to be extra precautious because of the risk that our family members have of contracting the virus and the potential the potential negative side effects that could have on their health versus like us who are young and maybe would probably be okay. I really try and look at it from their perspective and the fear that they have, and just to make sure that we're not putting them at any unnecessary risk. And so because of that, it's required some sacrifice of not seeing family as often. I haven't seen my in-laws in months, and I don't see my own family very often, despite the fact that they do live here. So there's definitely safety precautions and sacrifices that have been involved, but they recognize that it's important to continue education in the midst of this whole pandemic, because again, we never know when it's gonna end or when it's gonna subside. If there was maybe a more definitive end date to all of this, which I'm sure we would all love, then maybe it would be a different question and the decisions we would make would be different. But at this stage, I think it's taught us all a lot about flexibility and exercising that in the process. So starting out with orientation week, the majority of our orientation was over Zoom. So we had many speakers come in and share with us details about the school, and just kind of starting out, we talked to many professors, many different individuals and resources on campus. It was pretty much full-time, like full days every day for about a week. So the Monday and Tuesday of orientation was all online. And then we actually had the opportunity on Wednesday and Thursday to be in person. So I think we were the only program on campus that actually did part of our orientation in person. Part of the reason for that was because we needed to be in person for a technology day to help set up our computers and iPads. And then the following day, we had professional composite photos that they took of us. And when we had those in-person days, there were a lot of safety precautions that they really enforced. So even in order to be on campus, you have to fill out a survey to attest that you haven't been experiencing symptoms of COVID. When you enter the school, they take your temperature, they give you a wristband to confirm that you've gone through that process. And then obviously when you're on campus, you have to exercise social distancing. And so we were split into, our class of 80 was split into 2 different rooms, and all spread out in these massive lecture halls. So it was quite strange meeting our classmates for the first time in such a strange way, where we had seen each other over Zoom and like learning each other's names, and then we see each other in person with our masks and all covered up. So it's definitely taken us quite some time to learn each other's names, and it's been quite a unique process. But I think through it all, our class has also really bonded in a really unique way. I think it's forced all of us to connect with, like, make an extra effort to connect with each other through our group chats or over Zoom. And so I remember during orientation week, there being some really, really special moments of connection. I remember that we had one of the days where we were talking about diversity and inclusion, and it was a really wonderful session that was facilitated by one of the faculty members on campus. And the questions that she prompted actually really allowed us to open up in ways that maybe we wouldn't have actually done in person, which I thought was kind of interesting. And we kind of got a chance to get to know some of our classmates and hear their thoughts in maybe an environment that was a little bit less intimidating. Especially meeting some of those people for the first time. So I was definitely appreciative that we had that experience of orientation, and maybe there was a little bit less focused on the social side and the fun side. We unfortunately had to miss out on some of the bigger like family gathering days and some of the like social outings that we would have done. But everything that needed to be accomplished was during that week. Following that week, pretty much every day has been Zoom lecture after Zoom lecture. It kind of would have been in a similar situation if we were in person. We would be in a lecture hall together and receiving lectures from our professors. Luckily, we are lucky to have Zoom, and we're lucky that most of our content can be done through PowerPoints and us sitting in and listening. And luckily, all of our lectures are also recorded, so we can go back to those things as well. Certainly, it's presented some challenges when it comes to testing and individuals having resources to like adequate connection for Wi-Fi and those kinds of things. And so that's definitely been a learning curve, but luckily, since everyone is kind of learning together, they have been really taking in input from the students in terms of what is needed, what's working, what's not. And while communication can sometimes be challenging, they've definitely been open to us giving our own input to how we can make things better. And I do appreciate that our safety has been put first and foremost. You know, I think that there's a lot of question and speculation in other places about the seriousness of this pandemic. And while again, maybe the younger population aren't the most vulnerable, but I think that the steps that we take to prevent spread will hopefully help other individuals who are much more vulnerable. And I appreciate that the school is taking that so seriously, especially as a health science campus. You know, we see that like a lot of other college campuses are hotspots for this virus. And so I really do appreciate that the school has been taking it seriously. And when we are in person, there's very strict protocols in terms of how we go about interacting with each other. And to your, I realized I didn't answer part of the question about maybe interacting with other students. And so a lot of what we've been doing are Zoom study sessions. So groups of us will get together and we'll get to study, and it's maybe took a little bit of effort to reach out to friends, even though some of us hadn't met in person before or had only met briefly, but we've still been able to make it work and study over Zoom, or maybe like on one-on-one sessions in person too. Sure, absolutely. Yeah, so growing up, I think that because of the experiences that my parents had back in Iran before they had moved, the education has always been incredibly important to them. I think they really recognize that it's a source of empowerment to have, to be knowledgeable and educated. And unfortunately, when they were living back in Iran, due to the fact that they are from the Baha'i faith, they actually were barred from attending any kind of university level education. And so at that point, they had decided to move to the United States, and they did end up pursuing their own higher level education here in the United States. And I think because of that, it really passed on to my sibling and I that, first of all, education is incredibly important, but also that it's not something that should be taken for granted. So growing up, they definitely encouraged us to pursue higher level education, but we're really encouraging to use our own talents and abilities for whatever field suits us and can really give back to society and serve others. So with that in mind, I had definitely always been interested in the healthcare field. In middle school and in high school, I was definitely interested in medicine. I was interested in becoming a doctor, as most people who are interested in science are initially. And so I did a lot of volunteering, and then I ended up continuing that in college when I first began, and I started out pre-med. I actually don't have any doctors in my immediate family or anybody in healthcare. My parents are both in engineering and mathematics, and so they're definitely more in that field. So a lot of it was learning on my own and maybe from like friends and resources. So I started out college being pre-med. I also had decided to study public health for my undergraduate studies at the University of Colorado, Denver. So that really set the foundation for me in terms of thinking about the healthcare field, but also coming at it from a public health perspective and really thinking about prevention. So when I learned more about dentistry and found that it seemed to be a really great fit, I also kind of learned more about the ties between dentistry and public health, which I had never learned about before. I think when you think about dentistry, my own misconceptions were that it's a lot more about the like aesthetics of it and not necessarily the fact that it contributes to a well-rounded and healthy individual and healthy population. So, and of course my parents were encouraging of that because for them, at the forefront of their mind was that I'm getting an education and that it's doing something to contribute to society and to help others. And so the decision to also pursue an MPH during my DDS degree kind of came about very quickly. It's a new program here at the University of Colorado, Denver, to do a combined DDS and MPH degree. Most of the program, actually I think all of the program, is online, which is very helpful in terms of balancing out all of the dental school classes that we take. So I'm also, in addition to the 12 classes I'm taking for my first semester, I'm also taking 2 more public health classes. But the school has also done a really cool job of integrating public health concepts within our curriculum. And I think it's relatively new when you look at the history of dentistry. They're really looking at how do we prevent the prevalence of dental caries, in kids at a very young age, and also in adults, looking at fluorination programs and education and how that all ties into us as clinicians who are maybe seeing one patient at a time, but can still have an impact on the overall health of communities and populations. So the decision to get an MPH, I don't know where it's going to take me necessarily. There's a lot of options in terms of practicing public health dentistry. I know I definitely want to be in a clinical setting, and luckily you can do that in public health clinics. I think that it's, as I had mentioned before, this whole experience has really tested our flexibility. And being able to handle the things that are thrown at you that maybe you can't control and you don't expect. So I think that learning to really be flexible, that's probably advice that I would have given outside of even this COVID-19 situation, because when you're in dental school, you're going to face challenges that will really test you, and you have to adjust and fix your course as you go. But I think definitely on top of that, being flexible enough to adjust to the different changes that come with different COVID-19 protocols, or just learning from home and whatnot. So I think being flexible, and then also being willing to reach out and ask for help when you need it. Don't wait until you're really, really struggling and you're in the thick of it before you ask for help. Anticipate it and ask for help from your professors and colleagues and your friends, because they're there to support you and are happy to do so. And to really rely on those resources is really, really helpful. I think one of the things that really drew me again to dentistry is the level of support and connection that was readily offered when I started to explore the field. And so really taking advantage of that, I think, is important.